Tucker is a 4-year-old boy who recently received a diagnosis of autism spectrum disorder severity level 3. Tucker and his family are seeking services due to limited communication skills and challenging behavior. The team will determine which assessments to use based on referral concerns.
The VB-MAP age range is 0 to 48 months. It evaluates language, independent play, motor imitation, social play, group and classroom skills, linguistic structure, early academic, and matching to sample skills. It uses 3 assessments. It gains information through direct observation and caregivers' reports. This assessment has been proven to be 97% reliable. A master scoring guide is used to gather data. It includes a placement guide to help provide specific direction for each milestone, as well as suggestions for IEP goals. The ABLES has an age range of 0 to 12 years. It evaluates learner readiness skills such as language, academic, self-help, and motor skills. It gains information through direct observation and indirect methods of caregiver reports. There are empirical support showing that the ABLES has validity and reliability scores. A master scoring guide and a charts are used to collect data, and the ABLES has an accompanied guide with clear scoring instructions, including examples, as well as a guide for IEP development.
The pros for VP-MAP are more verbal behavior based. It assesses foundational learning skills and is 97% reliable. The cons for the VP-MAP are can only evaluate up to the age 48 months, does not put an emphasis in evaluating self-help skills. Some pros for the ABLES revised are can be used to evaluate children up to the age of 12, more academic based, can be more creative with the goals. And the cons for the ABLES are does not address or assess behaviors, and assessment is tedious and more likely to make a graphing error.
Tucker's primary care doctor referred him for an evaluation due to some developmental behavioral concerns. These concerns are identified. The first is minimal eye contact when engaging with peers. In VB-MAP, it's addressed in social behavior. In ABLES, it's addressed with social interactions. Aggression and property destruction is another concern. In VB-MAP, it's addressed in the barriers assessment and negative behaviors, where it's not addressed in ABLES. Functional play deficits are another concern, addressed in the VB-MAP in independent play for functional play with toys, and play and leisure for the ABLES, tolerating others touching toys. Social deficits are also a concern. This is identified in the VB-MAP for social behavior and social play, and ABLES social interactions. Non-compliance and elopement is also identified. In VB-MAP, it's in the barriers assessment, in negative behaviors, and instructional control, where it is not addressed in the ABLES.
Why we chose the VB-MAP. Based on the developmental and behavioral concerns presented, we believe that the VB-MAP will best address those concerns and skill deficits. We decided not to use the ABLES as our key concerns of our client due to minimal eye contact, peer aggression, property destruction, functional play deficits, and social skill deficits. Out of these key concerns, the ABLES only covers 3 out of these 5 as compared to the VB-MAP, going into depth addressing all 5 of our clients' concerns. The VB-MAP will be administered. The 4 to 10-hour assessment will identify the skill deficits and will guide the BCBA to select appropriate interventions to modify target behaviors that are socially significant.